If you've ever said your joints can predict the rain and someone gave you that polite, skeptical smile, science is on your side on this one. Weather does affect joint pain. Large studies strongly suggest it. And there are three distinct biological reasons why, each of which you can do something about nutritionally. By the end of this video, you will know what is happening inside of your joints when the temperature falls or pressure drops. And you will have three specific nutritional strategies that can help reduce how much your joints react to weather changes. You will learn four key things. Number one, the pressure mechanism drop that irritates your joint nerves before the rain arrives. Number two, why cold weather thickens your joint lubricant and leads to stiffness. Number three, how pre-warming your joints can improve mobility. And number four, how omega-3s, vitamin D, and ginger help ease joint inflammation and pain. Let's start with number one, barometric pressure, the weight of the atmosphere pressing down on everything. This barometric pressure drops before a cold front or storm arrives. Your joints feel this. Your joint capsule has its own internal pressure, and when the pressure from the atmosphere drops, your joint pressure inside increases slightly to compensate. This results in some of the joint tissues expanding slightly, which can affect the nerves around, causing irritation and inflammation. You can compare it to a balloon inside of a sealed glass jar. The moment you reduce the air pressure inside of the jar, the balloon naturally starts expanding. And in doing so, it starts pressing more into the glass around it. If your joint nerves are already hypersensitive from chronic inflammation, such as in the case of rheumatoid arthritis or osteoarthritis, they might feel weather changes much more compared to someone who is healthy and doesn't have any joint problems. A study led by Tim McAlidon and his colleagues tracked 200 osteoarthritis patients for about 3 months. They matched the patients' pain scores with local weather station data. The researchers found a link between barometric pressure drops and increased pain sensitivity, and the largest study of all done in the UK under the name Cloudy with a Chance of Pain. 10,584 chronic pain sufferers from the UK were tracked over 15 months. On the days when they had the most pain, the weather was humid, the winds were blowing hard, and the pressure was low. By contrast, the least painful days featured high atmospheric pressure, calm winds, and low humidity. The second point and reason why your joints feel different when weather changes is the synovial fluid. Synovial fluid is the lubricating fluid inside of your joints. Simply put, synovial fluid minimizes friction as your joints move and ensures smooth, pain-free movement. However, when the outside weather changes dramatically, for example, as the temperature sharply drops, so does the temperature of your joints drop, especially the peripheral joints like fingers, hands, knees. In this case, your synovial fluid thickens, which can reduce its lubricating properties and can make joints feel stiffer. This is because synovial fluid doesn't behave the same way water does. You can compare it to honey to an extent. At room temperature, it's fine, but if you put that honey in colder temperatures, it behaves differently. In healthy people, the weather changes don't affect the synovial fluid as much because their synovial fluid is healthy and functioning normally. It may thicken still, but they may not feel it at all. Compared to someone who has, let's say, osteoarthritis, their synovial fluid is already reduced in quality and they can therefore feel the changes in temperature more. This was confirmed in a classic 1957 study where researchers found that cold temperature increases joint stiffness and thickens the joint lubricant, the synovial fluid. And reason number three for your joint pain and stiffness because of weather changes is potentially low vitamin D. You see, when the weather is cloudy and cold, days are short and nights are long, it's perfect condition for not getting optimal levels of vitamin D. From roughly October to March, the solar angle is too low in most of the US, UK, and Canada, which means your body is not able to synthesize enough vitamin D on its own. Vitamin D is not just a bone nutrient. Vitamin D also regulates something called cytokine response. When vitamin D levels are adequate, your inflammatory response in the body is more likely to be healthier. However, when vitamin D levels are inadequate, it's more likely that the inflammation levels in the body, inflammatory molecules, might increase. This is an oversimplification of an extremely complex biological process, but you get the idea. Low vitamin D potentially equals increased inflammatory response in the body. A 2024 cross-selectional study of over 300,000 UK adults found a strong link between low vitamin D levels and increased widespread bodily pain, including musculoskeletal systems such as joints. Vitamin D blood levels tend to reduce by 15 to 30% during winter compared to summer. So if you're borderline deficient in July, you might be clinically deficient by January. Let's move to practical application. What can you do to actually help your joints fight weather-related changes? Step 1, reduce baseline inflammation so you have less to react with. You cannot change barometric pressure, but your joints are affected by this barometric pressure based on how inflamed they are at the baseline. So we're looking to reduce this inflammation. And one of the best things you can start taking if you are not already is omega-3 fatty acids, either through fatty fish or supplements. Specifically, the EPA and DHA omega-3 fatty acids directly compete with arachidonic acid, a molecule that promotes inflammation in your body. So when there's less arachidonic acid floating around and more omega-3 fatty acids, it might help your body modulate its inflammatory response better. Rather than a quick painkiller like ibuprofen, omega-3s are a slow structural support. Meta-analysis of 9 randomized controlled trials featuring over 2,000 osteoarthritis patients found that omega-3 supplementation can significantly reduce joint discomfort. Aim for about 1 gram of EPA plus DHA omega-3 fatty acids. This is not the same as 1 gram of fish oil that you see on the label. Make sure to see the small print and check how much exactly the EPA and DHA you get per serving. Ideally, you also want your fish oil to be in the triglyceride form, which is its natural form, not the ethyl ester form. Also, if you're taking an omega-3 supplement, make sure that the manufacturer is reputable and that the product is third-party tested. Omega-3 fatty acids, especially when taken in high doses, can have mild blood thinning properties. For this reason, talk to your doctor if you're on any kind of blood thinners or have a health condition before taking high-dosed omega-3 supplements. And remember, omega-3s are not a quick fix. It takes about 4 to 6 weeks to potentially start seeing results. Intervention number 2 is addressing the cold stiffness. It's by pre-warming the joint and taking ginger. You can pre-warm the joint by applying a warm pad on it and let it sit on your joint for 10 to 15 minutes. Alternatively, you can also do some gentle circular movements, for example, with your ankles. You can also do knee bends and hip tilts while you're in the bed in the morning. This helps warm up the joint and helps the synovial fluid start circulating. Alongside this physical drill part, you can also try consuming ginger. 3 grams of ginger, which is about a teaspoon, or a ginger supplement, can significantly help with joint pain in some cases. This is because ginger inhibits COX-2 pathway, the same pathway that ibuprofen targets. Obviously, ginger doesn't reduce pain to the same extent as a pharmaceutical drug. However, it does it at a more modest scale and is generally considered to be safer in the long run. A 2015 meta-analysis of 5 randomized controlled trials found that ginger can help reduce osteoarthritis pain and improve joint function compared to placebo. If you're taking a ginger supplement, look for one that is about 250 to 500 milligrams per serving. Ideally, it should have about 5% of gingerols, its main active component that is helpful for reducing inflammation. Much like omega-3s, ginger has some mild blood thinning properties, so it's best to consult your doctor if you're planning to take any kind of supplement. And third and final intervention you can do for weather-related joint pain is checking your vitamin D blood levels. First, you need to do the test to see how you're doing. If your vitamin D levels are between 30 and 40 nanograms per milliliter, this is considered the ideal range, and you don't really need to supplement in this case. However, if it's around 20 nanograms per milliliter or less, you could be deficient. In this case, vitamin D supplementation can help. Aim for between 2,000 and 4,000 international units of vitamin D through the autumn and winter season, of course, with the guidance of your doctor, especially if you have any kind of health condition. Also, make sure to take your vitamin D with vitamin K2 between 100 to 200 micrograms. Ideally, the vitamin K2 should come in the MK7 form. So, to summarize everything, weather related joint pain is a real thing. Studies strongly support it. It is due to three main factors: the drop in barometric pressure, cold temperatures, and also heavy winds, and low vitamin D levels. The two highest leverage nutritional moves you can start doing is taking 1 gram of EPA plus DHA each day, and then also taking a vitamin D supplement if your blood levels are low and you have your doctor's green light. You can also do some warm up movements and apply heating pads to your joints on cold mornings. One doorstep action for you for this week: if your vitamin D is low, talk to your doctor about supplementing it. After that, consider the omega 3s and ginger. What you drink can also affect how your joints feel. My 5 best drinks for joint lubrication video covers that. Go watch it next.